the SFMA, we are going to do cervical flexion, and I'm going to have the patient bend her head forward and touch her chin to her sternum, and that is a functional movement. Is there any pain with that?
No.
Okay, and then so she would receive a score of an FN with that movement, and then I will have her do cervical extension, and we're looking for a greater than 10 degrees parallel, and I'll ask her if there's any pain with that.
Mm-hmm.
So that is also a functional movement, and she will receive a score of FN. All right, the next exercise is cervical rotation with a lateral bend. She's going to do it on her left and her right side. Let's start with the right. So I'll have her twist her head to the right and touch her chin to her clavicle, and that is a functional movement. Was there any pain with that?
No.
So an FN for the score, and then have her do the same to the left side. Touch your chin. Any pain?
No.
Okay, functional movement, score of FN for both. All right, the next screening tool we're going to use is upper extremity pattern 1, and we're going to have her take her left arm and touch it to the inferior angle of her right scapula, and the fingers clear the scapula. Is there any pain with that?
No.
Then that is a functional movement. And so then we're going to have her take her right arm and touch it to the inferior angle of her left scapula, and she clears the angle. Is there any pain with that? Okay. And that receives a score of an FN. All right, and then we're going to move on to our upper extremity pattern 2, and we're going to have her take her left arm and raise it over her head and touch the spine of her opposite scapula, and the fingers clear, so that is a functional movement. Is there any pain with that?
No.
And then she would receive a score of an FN, and then she's going to do the same thing with her right arm, and the fingers clear. Is there any pain with that?
No.
And so that will also receive a score of an FN. So the next portion of the assessment is going to be the multi-segmental flexion, and so we're going to have her stand sideways, and then we're going to have her bend down to touch her toes. We are looking for no posterior weight shift. We're looking for her ability to touch her toes, and we are looking for no unusual curves in her spine. Rolling on to the next one, because that was a functional movement. Was there any pain with that?
No.
Okay, so rolling on to the next one, we're going to do multi-segmental extension, and she is going to raise her arms above her head, extend backwards. We're looking for her ASIS to clear her toes. We are going to look for the spine of the scapula and any non-uniform curves. So it looks good to me. That looks like functional movement. Was there any pain with that?
No.
All right. For multi-segmental rotation, we're going to have her standing at an angle so we can accurately assess her movement. We are going to have her twist to the right as far as she can go. We're looking for adequate movement of the hips and shoulders. Was there any pain with that?
No.
And that was a functional movement, so that will receive a score of an FN. Could you stand at an angle on the other side? Yep. All right, and now we are going to have her twist to her left. And that is a functional movement. Was there any pain with that?
No.
Well, there you go. Our next assessment is the single leg stance. We are going to have her raise her left leg to a 90-degree flip flexion and 90-degree of knee flexion, and she's going to hold that for 10 seconds. We're looking for her to keep her balance. We're looking for a hip drop or a knee drop, and she seems to have neither of those, so that is a functional movement. Was there any pain with that?
No.
Okay, and then we're going to have her do the same thing except with her eyes closed. So once again, could you raise your knee and your hip? And that looks like a functional movement to me, Allie. Fantastic. All right, we're going to have you turn around and do the same thing, but with your right leg. All right, and so a score of FN is, kind of expected here. Don't let us down, Allie, all right? And up, 10 seconds. And a functional movement. Was there any pain with that? All right, that's fantastic. All right, now I'm going to have you close your eyes. Same thing. No hip drop, no knee drop. And that is a functional movement. Was there any pain with that? So she receives an FN score for the single leg stance, both eyes open and eyes closed.